Hey, I'm Di McQueen, licensed clinical social worker, family and addiction expert. I'm here with Dr. Brian Jackson, my longtime cohort who specializes in the field of addiction. Welcome to Healing Families Shattered by Addiction.
Di and I have worked with addicts, alcoholics, and their families for over 30 years combined. Our podcast and coaching programs focus on families who have a loved one suffering from addiction. Our experience has been that this disease affects families as much, if not more, than the addict or alcoholic.
Is your world spinning out of control? Are you codependent? Are you experiencing worry, loss of sleep, and difficulty concentrating? If so, you're in the right place. Brian and I have both personally lived it, learned it, and now we're going to teach you tools and techniques on how to get your life back that you thought was shattered by addiction.
Okay, let's dive in.
Brian and I are so excited to introduce to you our new sponsor, Lakeview Health. They are a wonderful residential treatment center. Whether it's the family member who is looking for a place or the addict or alcoholic themselves, this would be the place that we would refer them to. Brian, you have many years of experience with Lakeview.
Yeah, Lakeview Health is a center of excellent addiction treatment. They take an evidence-based approach, medical approach to treating this complex brain disease. They hold the Joint Commission's Golden Seal, and they were voted one of America's best treatment centers by Newsweek magazine. They deliver dual diagnosis, gender-responsive, and trauma-informed care at their gorgeous facility here in Jacksonville, Florida. But they do see people from all over the world do come here to Jacksonville to go to treatment at Lakeview. Their levels of care include medically supervised detox, which a lot of people do need. Then they stabilize them in a residential rehabilitation and partial hospitalization program. They have board-certified physicians, master-level therapists, and they work to address the unique needs of each patient. So in other words, it's not a cookie-cutter program. They help individuals build skills for long-term sobriety. So if you or someone you know needs treatment, please visit their site at lakeviewhealth.com. We also have a hyperlink on our website at familyandaddictionexperts.com where you can just click and get some information about Lakeview Health. And Di, I think you have a number for people to call if they would like to inquire about treatment.
I sure do. That number is 888-480-3799. That's 888-480-3799. Give them a call.
For Healing Families Shattered by Addiction, and I think we have a topic that might be of interest to the entire family, whether it's the person who has the substance use disorder or the family members who are curious as to why this continues to go on when rationally, I think family members see people using and they can't understand why they can't just stop. So, we talk about substance use disorders and we talk about people with alcohol use disorders. And I think the misconception in a lot of places is that we are don't have much willpower, that we're of poor moral character, that there's something wrong with us, when in fact, we are above average intelligence and above average wage earners. All the research and statistics show that. So we're not, we're not dumb people. Okay.
Right.
And
right.
So people use because it's doing something for them. So in the beginning, I think a lot of people start to use those that have the illness and those that don't have the illness, and it's fun. So again, it's not stupid people, but some people who don't have the disorder are able to use it, take it or leave it, put it down. But for those of us who have a genetic predisposition or we've used so much that we really become dependent on the substance use disorder because of what it gives us. So in the beginning, it gave us a goodie, just like eating gives us a dopamine goodie. But with drugs and alcohol, I think people use because they're in pain, Di. What do you think?
I think that is certainly one of the things that, and why I wanted to talk about this today, which was kind of cool, which is, there's many other reasons too, but I think we both agree that we believe that people have they're in pain, whether it's physical, emotional, mind, body, spirit pain. There's something off, right? And they're trying to find a way to, in some fashion, self-medicate. Would you agree with that?
Yeah, and I think that, they're trying to heal that pain, whatever that pain is. For example, like if you go to the doctor for some illness, they might prescribe you something to help you feel quote unquote normal. And we've all, experienced that, being sick at different points in time in our lives. But for the person with an alcohol use disorder, I think that once you start ingesting and it metabolizes differently than the person that doesn't have the alcohol, the dopamine goodie research shows that the dopamine goodie that you get from an ice cream sundae is cool, but the dopamine goodie that you get from drugs and alcohol, if you are an alcohol, have an alcohol use disorder or drug use disorder, is 10 times that. So you think about the depletion of dopamine, the goodie that you get from it. It's the brain then says, "Boy, I want some more of this." And what happens then is that your brain gets hijacked, and the pathways to the brain are saying, "I want some more of this."
Well,
This
yeah,
feels really good.
yeah, we
This
sure did
feels,
that, didn't we?
yeah, we did.
We did, but understanding the neurobiology behind it, I think, is also really important, right? Like in time, there's only so many, the receptors start to wear down. Am I right? Where they start to kind of deplete. And I mean, they're not able to keep reproducing it the way that they were, which then increases our
Right,
tolerance, which then starts another issue, as we talk about, right? We need the disease of the mores, which is more and
right,
more and more for less effect.
right. So, like you're explaining, is that we use more and more to try and get the same desired effect that we were getting back when we had, a big reserve of dopamine. So, not only are we now using more and more, and I think you and I talked about this, and it's an important point, is that you become physically dependent on it because you are using so much of it. So when you try to stop, you're going to experience, depending on what the substance is, some very uncomfortable withdrawal symptoms. And so the big challenge, I think, for people who uh, get into this position is, and for clinicians, is to try and understand like which came first, the chicken or the egg. I mean, we are saying people use because they're in pain. And most of what we see, I think a lot of times is some sort of either trauma or depression or anxiety or something of that nature where you're able to calm that feeling down or block that trauma out, if you will. So it's not as painful when you think about whatever it is. But when you come out the other side, let's say you're fortunate enough to have a moment of clarity and stop, if you think about what you've done to the dopamine receptors or what the substances have done, you're not getting that. And so you come out the other side and you're going to feel some depression and or anxiety. And that's why we typically, refer out to people for maybe some, medication assistance to, um, kind of steady the mood, if you will.
Yeah, I absolutely agree with you, B. And we've seen it, you and I've seen it over and over and over again. But here's the interesting part, right? Twofold. People always ask me, I don't know, I'm guessing they ask you as well. But Di, is my chemistry going to balance itself out? And the answer to that question is we don't know yet, right? Like it depends how long you've been using, what you've been using, how that's going to work out. But we do know that there are different kinds of medical assisted treatments that we can do to help. But oftentimes it actually does rebalance itself. And that's the really cool part. But then the real work begins, right? Which is what you and I are
Mhm.
talking about today, which is how do I become emotionally sober? How do I get a blend of mind, body, and spirit? Most of the folks that we see, have not got a really hard and fast, deep and wide bucket of coping mechanisms, right? They didn't know. So, if you just go back to doing just what you've been doing, really nothing changes, right? So we have to start working on why are you doing this? What's the why? Where does it come from? Does it start from, early childhood, which oftentimes it does? But even that, sometimes digging in there, gets us, to where we want to be. We want to figure out and we want to help them understand. So we quit doing the same things again and again and again, which we call insanity, right? How did I get here
Right.
again? How did I get here again? And that's what we do. So may have started off with, I'm trying to numb out a pain of some kind, but we don't get too far unless we start to learn and redevelop new skill sets and figure out what we need to do to make sure that when that particular event occurs again, we have a new strategy. And you and I spend a lot of time teaching people that, right?
Yeah. And so, back to the brain science of it, if you think about people stopping and the dopamine goodie they were getting and the brain being trained and the pathways wanting that goodie, it's very difficult. It's very difficult. And like you said, the brain is trying to heal itself. And there's a lot of plasticity in the brain, and neurons and all that stuff can reconnect. And like you said, it depends on what your substance of use was. A lot of research tells us that the brain, the body, with alcohol, people that stop around the 12-month mark, you're pretty much, and then again, this is not for everybody. Everybody's wired differently. Around the 12-month mark, everything's put back the way it was before we started. So, that first 12 months is really critical. But going again with the brain, the dopamine goodie that we were getting, what happens is the serotonin receptors that control our mood, they basically stop working. They're like, hey, Brian's putting a party on for me every night. Why do we even need to work? And so people stop, and the serotonin receptors now get up and try and run. And so one day it's like starting up a car you haven't started up in 10 years. And
Yep.
one day you may get a big shot of serotonin and go, wow, this is fabulous. I'm so happy that I quit using. And the next day you don't get any. So
Right.
then it becomes like a roller coaster, up and down in terms of highs and lows, and susceptibility to relapse is very high. And so we're really not pushing medication. And obviously, a provider would have to assess you, evaluate you, and say, you know what, I think an antidepressant, if we put this in place, will help you with the depression, with the lows that you're feeling. And so, therefore, once that's in place, then the highs and lows are not as traumatic. And we want people to be stable, feel comfortable in their own skin, and not be really just, craving and trying to learn different coping skills that you refer to. Um, and so that's the best scenario when a person is really feeling better physically, mentally, emotionally, for them to be able to
Right.
get some traction in recovery.
Yes, both of us agree that it is not a straight line and it is not a simple process, right? There's not a one size fits all. The SSRIs that might be helpful, other things that we've seen, people start working out, right? Which is
Yes,
another, and I'm
yes,
not talking excessively. I'm not talking about the let's put that addiction to the next thing, which we have a tendency to do as well. But that is why, right? I mean, what you're discussing and what we're talking about in the neurobiology is often the reason why we jump from one thing to another, because our brain is looking for that, right? But exercise has many benefits to it, and one of them is that it will release dopamine in a way that helps people calm down. It's a calming, and it feels pretty good, and there's a physical reward for it as well. So we always encourage those types of things, gentleness training, on how to be easy on yourself, and really understanding the whole concept of why people use is a really important one, I think. I definitely do. And I think it's a lot sometimes missed when people are starting to learn about addiction, that they don't even understand why they did that.
yeah, and obviously in this day and age, there's a lot of people that are now acknowledging that they have depression
Right.
or whatever. But I read this really interesting article the other day, and they were talking about different things for depression. And the number one thing that they said was most effective for depression was exercise,
Yep.
um, above medication. That doesn't mean you can't exercise and be taking medication, but
Right.
the endorphins that you get, the dopamine release that you get from exercise, and it's also really important because you can't think about two things at once when you're exercising. I mean, unless you're just walking. So sometimes some of the thoughts that we have that fragment us or we obsess on, you'll get a break from that while you're doing your exercise routine. So,
Yeah, and I
and that's
love
why,
that. That's a great point, B. I love that point, which is staying present in where you are instead of going the trails that our brain does, right? I mean, we're notorious for trailing forward or backwards and really perseverating on that thought. So I love that. That's a great point that you just pointed out, which is most of the time when we're exercising, we can't be in two places at one time. So it's good.
yes, I think one of the most important messages for families and for a person who may be suffering with this is that just going and getting detoxed and then maybe even going inpatient is just the beginning of the journey. I mean, families get all excited, that, oh my goodness, they went to treatment and they've stopped, and they get out of treatment and the hope is that they're going to stay stopped. Well, just doing nothing is really not a good formula for continued sobriety. So drinking is one thing, not drinking is another thing, but how do we have a continuum of care in this not drinking, not using phase of our lives? So there are things that we uh, or that we suggest and recommend that we do, and one of them is to get out and do some reasonable exercise, proper nutrition, interacting with other people, developing a sober network of friends, getting to meetings, medication assisted treatment if you need it.
If you
Um,
need it,
and,
right?
and
Absolutely.
yeah, individual counseling, family counseling. The more things that you can put on your team, if you will, the better your chances are of staying in recovery. So
And
back to the point.
let's go in one step further with that to wrap up. I know a little bit, which is also the family side of it, right? Like they're
Mhm.
not immune to any of these things too. The only difference is the substance is the person, right? The
Right.
relationship that they're addicted to. And they need to be able to find those things as well because they also fall into those categories of being so depleted. So, trying to find a way to numb out, lost trying to figure that all out. So I think it's really important that they understand that that also applies to them in the sense of getting the recovery tools in place. Everybody needs to do their part. So this whole mechanic comes back in line or actually becomes a place where everybody is healing. Agreed?
Yeah, and that's a good point because family members, they get so overwhelmed by this. And so a lot of
Yep.
times they'll get stuck or frozen. I don't mean completely stuck, but they'll start um, giving things up that they used to do that were healthy for them.
Yeah.
Talking about exercise. Next thing you know, you're not going to the gym or you're not eating right, but you're definitely, maybe not sleeping, the way you should sleep. And so how do you disconnect from, this illness that affects the entire family and take care of yourself? Because, you need to be in a healthy spot to help somebody that's unhealthy stay in their healthy spot once they get there. And so we don't want you to be run down and exhausted by this and have your life contingent upon whether your loved one, gets well or not. And but it's very easy to fall into that trap where all of a sudden this becomes the number one thing in your life, and it creeps up on you like a fungus. It just does. And so it's important to have the awareness, that Di talked about. That wait a minute, I've got to take care of myself. I can't stop the world and wait for somebody to get help.
100% agree. It's a tough situation when we find out that we've been dancing the wrong dance steps all along because we just didn't have the education, nor do we have, potentially some of the chemistry situations that are going on in our brain. Really understanding the brain chemistry and the neurobiology behind all of this makes a big difference, which is why Brian and I totally agree this is a disease. It is not something that just, is not working right. But if you really understand that addiction is not just about what the actual thing, alcohol, drugs, shopping, etc. but there's stuff going on in the brain that makes that all work. And we have to understand that to be able to understand what is happening to the person that we love and care about.
Exactly. So, it's the addiction to the dopamine goodie,
Yep.
and it can come in all forms, all kinds of substances. And like you said, it could be gambling, it could be shopping, it could be pornography, it could be all kinds of things, overeating. So we got to be careful not to switch chairs on the Titanic once we stop using substances and looking outside of ourselves for that goodie, and just be able to be comfortable with yourself. So
Exactly. So we're going to keep working on the things that we do to make sure that we keep helping people. We have a free resource page on our website, which we would love for you to join in on. And hopefully there's some information in there that you can utilize. So that's www.familyandaddictionexperts.com. We also have, if there's something that you need to talk about or questions, we love those, and we're happy to answer any questions we may have, or you may have, excuse me. Please email us, right, at info@familyandaddictionexperts.com. And we'd love to hear from you guys. Anytime, questions, let us help you. Bry's awesome. And we have
so Di. Good.
There we go.
Good to
We
be
love each other. No, we really do. We have a lot of respect for one another and how we operate and the knowledge. And we're always trying to learn what's going on, more information so that we can best help you, and stay in the present on the research and everything else that goes with it so that we can help all sides of this whole family nucleus to be able to put it all back together. So it's always a pleasure, B. I always
Yeah, it's
love
good to be with you, Di, and
Yeah.
thank everybody for listening. If you have any questions, contact us
We'd
or
love
come
it.
see us. Come
Yes.
see us.
Come see
Free
us.
consultation.
Oh yeah, we have a free consult. Do that, right?
Right.
If you need to, we'd love to meet with you. All right, until the next time, I'm Di, and this is
Thanks, Di.
Brian.
Right.
And thank you, B. I appreciate it. And this is Healing Families Shattered by Addiction.
Thanks so much for joining our podcast, Healing Families Shattered by Addiction. We'll be back in a couple weeks with more important tools, techniques, and ways for you to focus on you instead of the alcoholic or addict in your world. Until then, please go to our website, familyandaddictionexperts.com. That's familyandaddictionexperts.com. You'll also see links to our Facebook and Instagram pages. Please also, if you have any emails that you would like to send us, that's info@familyandaddictionexperts.com. That's info@familyandaddictionexperts.com. With any thoughts, feelings, questions that you may have for us, we would love to hear from you, and we look forward to seeing you in a couple of weeks.